Assalamu alaikum. My name is Dr. Muhammad Musbah Shaheen, and we are talking about endodontic materials used in dentistry. In our previous lecture, we discussed about introduction of endodontics, indication and contraindications of endodontics, objectives of endodontics, procedure of endodontics, introduction to different materials used in endodontics, what is irrigation, what are different irrigants available in the market which are used in dentistry, their types and properties. In today's lecture, we will discuss about what is meant by intracanal medicaments, different types of intracanal medicaments used in endodontics, their functions and properties, limitations of intracanal medicaments, endodontics sealers and their ideal requirements, and different types of these sealers. First of all, we will talk about intracanal medicaments. If a root canal treatment cannot be finished in a single visit, root canals are dressed with medicaments. A medicament is an antimicrobial agent that is placed inside the root canal between treatment appointments in an attempt to eliminate remaining microorganisms and prevent reinfection. Ideal properties of intracanal medicaments are: intracanal medicaments should be biocompatible, should have antimicrobial effect, can penetrate into dentinal tubules, should be able to control exudation or bleeding, should be able to eliminate pain, and can induce a calcific barrier. Intracanal medicaments should be radio opaque, so we can see them into the radiograph, and they do not stain the tooth. What are the different functions of intracanal medicaments? There are some primary functions and some secondary functions. Primary function of the intracanal medicament is antimicrobial activity, which is antisepsis and disinfection of the canal. Secondary functions are hard tissue formation. It means formations or regeneration of cementum or dentine in case of open apex or internal resorption. Pain control, exudation control or bleeding control, and resorption control. In picture, you can see there is a swelling in posterior mandibular region. In this case, we will use intracanal medicaments to kill the microorganisms and to disinfect the canal. And in this radiographic picture, you can see there is a root resorption. In this case, we will use intracanal medicaments to form a calcific barrier against which we can do obturation to stop this resorption. There are different types of intracanal medicaments available. Phenolics, it includes eugenol, CMCP, parachlorophenol, camphorated parachlorophenol, cresol, and thymol. Next is aldehydes. Aldehydes include formocresol and glutarialdehyde. Next type of medicaments is halides, which include sodium hypochlorite, iodine, potassium iodine, and chloramine T solutions. Other types of medicaments are steroids, heavy metal salts, calcium hydroxide, antibiotics, and a combination of antibiotics and steroids. First of all, we will talk about calcium hydroxide, intracanal medicament. It has antibacterial effect and pH is more than 12. It is cheap. It can denature protein of cell membrane of bacteria. Synergistic with sodium hypochlorite, calcium hydroxide causes local necrosis and can form calcific barrier. Calcium hydroxide dries weeping canal and is indicated for apexogenesis and apexification. Other medicaments we use in routine dentistry are antibiotics, which is tetracycline, or steroids, which are triamcinolone or prednisolone, or we can use antibiotics and steroids in combination, which is available in the form of Latermax in the market. Latermax is a combination of antibiotics and corticosteroids. It is uses in case of severe pain because it has corticosteroid which has anti-inflammatory effect. Latermax is a non-setting water-soluble paste material with a combination of a tetracycline antibiotic, which is dimethylocycline HCl at concentration of 3.2%, and a corticosteroid, which is triamcinolone acetonide, concentration is 1%, and a polyethylene glycol base. Latermax is a controversial material because of the presence of steroids. Next intracanal medicaments we use in routine dentistry is Christophine. Christophine disinfects the root canal with a powerful bactericidal agent, which is parachlorophenol. It contains dexamethasone for its anti-inflammatory properties and also contain thymol and camphor for their antiseptic properties. It means Christophine is a combination of parachlorophenol, dexamethasone, thymol, and camphor. Christophine ensures sterility of endodontic spaces during vital pulpectomies. It may be used for sterilizing deep cavities. There are some limitation of intracanal medicaments, which are intracanal environment. The therapeutic action of these medicaments depends on the direct contact on the tissues, but these substances probably do not reach all the areas where bacteria or tissues are present and are limited to the surface action only. Duration of the intracanal medicaments. To be effective, these agents should remain chemically active during the time of inter-appointments. Phenols-based intracanal medicaments lose their activity very quickly within 24 hours. Calcium hydroxide retains the antimicrobial action for a prolonged period of time. Now we will talk about endodontic sealants. Sealants play a primary role in sealing the canal by obliterating the irregularities or spaces between the canal walls and root canal materials. Sealants act as a marker for accessory canals, resorptive defects and other voids into which main core material may not penetrate. What are the ideal requirements for endodontic sealants? Tissue tolerance, non-irritant and non-toxic to periradicular tissues, dimensionally stable, insoluble in tissue fluids, radio opaque, so we can see the sealants into the radiograph. In the picture you can see white radio opacity in the periapical region, which is sealant extruded from the apex into the periradicular tissue area. It can resolve with the period of over the period of time. Sealants should have good adhesion to canal walls, hermetic sealing ability. Sealants should be bacteriostatic or bactericidal effect, easy to mix, non-staining, have slow setting time and easily removed if necessary. Functions of the root canal sealer are: sealers serve as a filler for canal irregularities and minor discrepancies between the root canal wall and core filling material. Sealers are used to obturate the lateral canals. Sealers act as lubricant. Sealer enhances the possible attainment of an impervious seal. Sealers can assist the microbial control and for radio opacity. This diagram is showing what can happen if we do not use sealer and what can be advantages of sealer. In top picture you can see there if we do not use sealer, there will be a micro space between the root canal wall and core filling materials, and if we do not if we use in a sealer, it will seal that space and there will be no room for microorganisms, which will prevent reinfection. No. Classification of currently employed root canal sealants. They are zinc oxide eugenol based sealers, which include Grossman's formula, Roth's 801 and Tublis seal. Calcium hydroxide based sealers, it includes Sealapix and Apix-it. And we have glass ionomer based sealers and resin based sealers. Resin based sealers include AH plus, AH26, Epiphany and Diakit sealers. Now we will talk about those sealers which are commonly used in dentistry. Number one is zinc oxide eugenol based sealers. Zinc oxide eugenol cements are modified for endodontic use. Mixing vehicle is mostly eugenol or in combination with other liquids like Canada blossom. Setting time adjusted for adequate working time. Radio opacity is 4 to 5 mm of aluminium. Grossman's formula sealant. This is modified zinc oxide and eugenol based sealant. Modified zinc oxide and eugenol sealants are widely used and are exemplified by Grossman formulation of. Basically, it consists of powder and liquid. Powder contains 42 parts of zinc oxide, 27 parts of stable light resin, 15 parts of bismuth subcarbonate, 15 parts of barium sulfate, and 1 part of sodium borate. And liquid is eugenol. Properties of Grossman's formula sealants are exceptionally long setting time up to 2 months, has been shown to give consistent results with a good peripheral seal, and filling is retrievable, so we can remove this sealant easily. Next is calcium hydroxide based sealants, which include Sealapix. Sealapix is non-eugenol calcium hydroxide polymeric resin root canal sealer. 100% humidity, takes 3 weeks to reach final set, and never sets in dry atmosphere. Sealers expand while setting. Next calcium hydroxide based sealer is Epixit. It is available in the form of syringe, and composition is base and catalyst. Base include calcium hydroxide or calcium oxide 36.9% by weight, hydrated colophonium 54% by weight, and fillers and other auxiliary materials are 9.1% by weight. Catalyst include disalicylate, which is 47.6% by weight, bismuth hydroxide or bismuth carbonate, which is 36.4% by weight, and fillers and other auxiliary materials are also present, which is 16% by weight. Advantages of the Epixit are excellent biological tolerance, easy to mix, radio opaque, hard setting. As you can see in the picture, Epixit is available in syringe form. In syringe there is a base and catalyst, and when we press it, both catalyst and base are mixed automatically, so we do not need to mix the base and catalyst separately. Next is resin based sealants. Epoxy resin based sealants are available with a formulation of powder and liquid. Powder contains bismuth oxide, which is 60%, hexamethylene teramine 25%, silver 10%, and titanium dioxide 5%. And liquid is epoxy bisphenol resin. Example of resin based sealants are AH plus or AH26. Properties of resin based sealants are: resin based sealant provides good seal and has antimicrobial action. Disadvantages of resin based sealants are: silver containing formulation is associated with staining of the dentine. It means it can cause staining of the dentine, which results in color change of the tooth over the period of time. And the other disadvantage of resin based sealants is it can release some amount of formaldehyde, which is tissue toxic. The most recent version of products have lower level of formaldehyde release. This is the procedure of application of root canal sealer. First of all, obviously we will measure the working length, and we will do root canal preparation and shaping and cleansing. Then we will use intracanal medicaments and irrigants and intracanal medicaments to disinfect the canals. After that, we will dry the canal with the help of paper points, and then we will use paper point to put sealer into the canal, and excess material is removed. Applying excessive sealer prior to obturation results in adequate flow of the gutta percha, because as you know, sealer act as a lubricant. Lack of gutta percha at the apical extent of the canal, and an unacceptable apical seal. Reactions of the obturating materials. If the material is extruded into the periradical tissue, it can be highly irritating and may reduce the probability of healing by about 25%. So sealer should not be extruded from the apex, especially which are irritant to periradical tissues, like zinc oxide eugenol type sealers. Zinc oxide eugenol type of sealers are probably irritating because of the eugenol. Epoxy resin sealers are more biocompatible, and all the filling materials should be confined to the root canal. It means filling materials should not extrude from the apex. There is a video in which you will be see how to put sealer into the root canal. Well, this is the procedure how we will put sealer into the canal. This is the whole from today's lecture. The remaining endodontic materials like paper point, gutta percha, and the materials which we use in surgical endodontics will be discussed in next lectures. Thank you so much.